Joining us now is Democratic Senator Lisa Blunt Rochester of the great Commonwealth of Delaware. Senator, thank you very much for coming to the weekend.
Thank you for having me. It's good to be here.
So, to channel Senator Thune and House Speaker Johnson, when are you going to vote to reopen the government?
It's a very good impersonation.
Yes.
I don't know if that was a good impersonation.
Thank you.
But I will say, with all seriousness, for Democrats, this moment is truly pivotal. You know, we know that millions of Americans are at risk of either losing their health care because of the big, beautiful bill, or having to face the decision of, what do I do when I look at my bills?
Yeah.
Energy costs have gone up, food prices have gone up, rent has gone up, and we're on the brink of healthcare costs going up. And so people are going to have to make very difficult decisions. And so for Democrats, we're saying, you know, number one, the government should be open and we should be doing our job. And number two, we need to make sure that people don't have to face this kind of crisis. It's not necessary. It's unnecessary. And so get back to Washington and do your job.
Yeah. So you're not going to vote on this so-called clean CR until they do something about health care?
It's funny, you know, they're using the word clean CR and nonpartisan. You say nonpartisan when it's not bipartisan. Mm-hmm. These are usually bipartisan bills that we do and that we negotiate. And so, you know, to me, you can't say you are for something and then you are against it. And that's what's happening both with federal workers. You know, they're saying you support federal workers, but yet the plan was always to fire federal workers. It started back in January.
Is that a no? You're not voting for the bill?
That's clearly a no.
I want to be clear.
That's clear. Now, let's be clear as well. You know, even as recent as this week, I was one of the members that was in a huddle on the Senate floor.
Right, I saw
with
that.
Republicans saying, look, we want to do what's in the best interest of the people. And so, you know...
What were the Republicans saying back to you?
I think it was interesting because...
Feel free to name names.
I will say, you know, one of the main people sitting in that conversation was Senator Mike Rounds. And we talked about the real impact on the American people as it pertains to health care. But my point is this is no time for just a handshake deal.
Can't trust them, can you?
Those days are gone right now. And so, to me, even if Senator Thune said the rank and file can maybe talk, we know that Donald Trump is really the one who controls this. And I don't know if his folks are telling him that half of our small businesses are on the Affordable Care Act, a quarter of farmers and ranchers. The people who are most going to be impacted by this are people from red states.
Right, yeah, actually, I think it's worth reading some of the stats there quickly, that of the 75 congressional districts where at least 10% of the population is enrolled in the Affordable Care Act, 62 are red-leaning. Florida, Georgia, Texas, and more than half of those 62 districts in states are represented by Republicans.
Yes. So, you know, I think there are some Republicans who want to come to the table. Josh Hawley himself said this is a problem. But if you have a president who is maybe not clear on what's going on, and you have a Speaker of the House. Now, remember, I came from the House of Representatives. I've served there for 8 years. And we always, through the Biden administration, we didn't even have a shutdown.
Well, so that's my question to you. When you were in the House, what we saw was, though there was a lot of disagreement, we had Shalonda Young here, the O&B director, who was leading a lot of those conversations between House Democrats and House Republicans on some of this stuff. We never heard Democrats say, or the President Biden say, there's nothing to negotiate.
Right.
And I'm curious what you think of Majority Leader Thune saying we're not going to negotiate, when that's literally the only job you guys have, right? Like, your whole job is to sit down, negotiate, figure out some bills.
Right. You know, I think, again, even the thought of Hakeem Jeffries and Leader Schumer going in to meet with the president, they pulled that meeting. The Speaker said, no, I don't want them to meet. And so I think that doesn't exhibit leadership in this moment. That's pure and simple. It doesn't exhibit leadership. And, you know, again, I think about my constituents. I think about this woman, Jan, who, when I ran back in 2016, because I came in with Donald Trump, I came in the minority. And when I ran, one of the reasons was because of the Affordable Care Act. And Jan is a small business owner. She had suffered through cancer. She said the Affordable Care Act saved her life. Not saying it's perfect, but right now, when I met with her about a week or so ago, she was concerned about her premiums doubling. And what might that mean? This is about life saving. This is about our economy. Like, all of us are going to be impacted. And I think that's the message that I hope people understand, that yes, there are millions of people on Medicaid that are impacted by that big, beautiful bill. Yes, there are families across the country, but even businesses, this is going to affect all of us.
Delaware Senator Lisa Blunt Rochester, thank you for coming to the weekend.
Thank you for having us.